What is angle-closure glaucoma? Angle-closure glaucoma is a type of glaucoma where the front part of the eye, the drainage angle, becomes blocked. In a healthy eye, a clear fluid called aqueous humor flows through a space called the anterior chamber behind the cornea and in front of the iris and drains out through tiny openings. In angle-closure glaucoma, the colored part of the eye, the iris, bulges or moves forward and blocks the drainage angle, so the fluid cannot leave the eye. When fluid builds up, it raises the pressure inside the eye. If this pressure rises suddenly, it can cause severe eye pain, blurred vision, halos around lights, nausea, and even rapidly lead to vision loss. In simple terms, angle-closure glaucoma is like a sink whose drain gets suddenly blocked, causing the water, eye fluid, to back up. This needs prompt medical attention. The anterior chamber and what's shallow means the anterior chamber is the front part of your eye. It's the space filled with clear fluid between the cornea, the clear window at the very front of the eye, and the iris, the colored ring around the pupil. You can think of it as a small bowl of fluid at the front of the eye. The depth of this chamber, how deep or shallow it is important. A deep chamber means there is plenty of space in front of the iris. A shallow chamber means the iris is closer to the cornea. When the anterior chamber is shallow, the drainage angle at the edge of the chamber can be very narrow. A narrow or shallow chamber can limit fluid flow out of the eye, and research links shallower anterior chambers with a higher risk of glaucoma. In other words, imagine a shallow bowl versus a deep bowl. In the shallow bowl, there is less room for fluid to circulate, making blockage more likely. New research: how eye shape changes with age. A study published in March 2026 looked at how the anterior chamber changes as people get older. Researchers in Japan measured the anterior chamber depth, ACD, in a large group of adults of different ages. They found that the chamber tends to become shallower, smaller, more quickly in younger adults than expected, and then the change slows down in middle age. In plain language, most of the change in eye shape happens earlier in adulthood rather than steadily getting worse in older age. In fact, in one Japanese health screening study of over 3,000 people, age was a strong predictor of ACD after accounting for other factors. This means that by the time many people reach their 40s or 50s, their eyes may have already reached a stable shape. In effect, people who will have narrow angles tend to already have them when they are younger. By contrast, other studies have shown that overall, ACD does decrease with age. But the new finding is that much of that decrease may occur earlier than doctors used to think. In practical terms, it suggests that the risk factors for angle closure may be set up earlier in life. However, it's important to remember that even if your eyes are a bit narrow when you're younger, that doesn't guarantee problems later. It just highlights that any risk might start early. This research is a piece of the puzzle, and it shows doctors how eye anatomy tends to change over time. Why this matters for early assessment. If narrower angles tend to develop by middle age, eye doctors might want to look for narrow angles earlier. Normally, angle-closure glaucoma is thought of as an issue for older adults, but this study suggests paying attention to angle width even in your 30s or 40s if you have risk factors. Early detection can be helpful because there are simple treatments and follow-up strategies to prevent problems. For example, if the drainage angle is narrow, an eye surgeon can perform a quick laser procedure called a laser peripheral iridotomy that makes a tiny hole in the iris. This hole lets fluid flow more freely and helps keep eye pressure safe. Knowing that the eye's angle may stabilize in midlife is reassuring in that it may not continue to close rapidly in later years. But for at-risk people, it underscores the importance of regular eye checks. In other words, doctors can use this information to tailor who to monitor more closely and when. It does not mean everyone will develop glaucoma, but it tells doctors and patients that if an eye is already somewhat shallow when you're young or middle-aged, that is when it's best to pay attention. Why this matters for people at risk of angle closure. Some people are naturally more likely to have narrow angles. For example, people with hyperopia, farsightedness, often have shorter eyes and narrower chambers. Being female, having a family history of glaucoma, and being of East Asian or Inuit Arctic heritage are also known risk factors. Age is a risk factor too. Angle closure is more common over age 40. If you fit any of these risk factors, this new information is important for you. It means your eye doctor may especially want to check your drainage angle early and possibly repeat the check at shorter intervals. For anyone at risk, the takeaway is be proactive. Mention any family history or symptoms to your doctor. If you are farsighted, you need reading glasses early, for example, or of Asian descent or older age, or if you've had an eye exam where the doctor noted a narrow angle, then make sure your eye care provider keeps an eye on it. The study reminds us that in people at risk, the narrow angle can be identified well before it causes trouble. By identifying narrow angles early, even before any eye pressure rise, you can work with your doctor on a plan, like photos, laser, or just careful monitoring to keep your eyes safe. What this does and does not tell us. What this does tell us is how the anatomy of the eye, specifically the depth of the anterior chamber, changes over the decades of life. It suggests that a lot of the change happens by middle age. This helps doctors know when to look for narrow angles. However, it does not tell us that everyone with a shallow chamber will get glaucoma. In fact, only some people with narrow angles ever develop angle-closure glaucoma. A long-term study showed that eyes which eventually had angle closure often started with shallower chambers, but many people with narrow angles did not progress. In simple terms, having a narrow angle is a risk factor, not a diagnosis of glaucoma. It's like saying you have a family history of diabetes. It means you need to watch your diet and check in with your doctor, but it doesn't mean you will definitely become diabetic. This new study does not change the basic fact that narrow angles only sometimes lead to disease. It also does not replace regular care. Even if your angles are normal now, you still need routine eye exams as you age. And it doesn't give an exact cutoff or prediction for any one person. In other words, don't panic. Use the information as another reason to stay watchful. Ask questions, but know that angle closure usually takes time to develop and can often be prevented with early action. What you can do: eye exams, gonioscopy, and follow-up. The simplest and best thing you can do is to keep up with regular eye exams. Everyone needs routine eye checks, even if you have perfect vision, at least every 1 to 2 years. If you have risk factors for narrow angles, mention them, and your eye doctor may do a special test called gonioscopy. Gonioscopy is a painless procedure where the doctor uses numbing drops and a special mirrored lens or a special camera to look directly at your drainage angle. This test shows how open or closed the angle is. If your angles are narrower than normal, your doctor may suggest precautions. For example, avoiding certain medications that can tighten the iris, like some over-the-counter cold pills, or ensuring your pupils aren't dilated too widely without supervision. In many cases, if the doctor sees a narrow angle, they'll recommend a preventive laser, as mentioned above, or simply schedule you for frequent pressure checks. The key practical point is that gonioscopy can find narrow angles before any pressure spike occurs. With this information, you and your doctor can plan follow-ups and make choices that keep your eye pressure safe. Always feel free to ask your doctor to explain if your angles look narrow. You can say something like, "My eyes are slightly farsighted. Should we check my angles?" Or, "Does my family history mean I should get gonioscopy?" Good communication ensures nothing gets overlooked. And remember, if you ever experience symptoms like sudden eye pain, blurring, or halos around lights, seek care immediately. Acute angle closure is an emergency. But if you have no symptoms, regular exams and gentle checkups, gonioscopy, are usually all that's needed to stay ahead of potential trouble. Who may want to ask their eye doctor about narrow angles? If any of the following apply to you, it might be worth bringing up narrow angles at your next eye exam. You're in your 40s or older, especially if you have not had an eye exam in a while. You are farsighted, you need reading glasses, or make distant objects fuzzy. Farsighted eyes often have shallower anterior chambers. You are of East Asian or Inuit descent, or your family is, angle-closure glaucoma is more common in these groups. You have a family history of glaucoma or narrow angle. Ask relatives if they ever had this diagnosis. During an eye exam, your doctor noted that your iris looked very close to the cornea, or simply said you have big pupils or thick lens. Both can suggest narrow angles. Bringing these points up with your eye care provider can help them decide if special checks like gonioscopy or early treatment are right for you. Above all, stay informed and proactive. This new study reminds us that eye changes happen over many years, and catching narrow angles early can help protect your vision. Sources: reputable eye health organizations and recent research confirm these points, so you can have confidence discussing them with your eye doctor. All links to sources are available in the text version of this article. You can find the full article at visualfieldtest.com. Thanks for listening. To check your visual field, click the link at the bottom of this article or visit visualfieldtest.com.